Hello and welcome. I'm John Garlick and I'm here with Sheriff Matthew Wade, and this is Calhoun County's Most Wanted. Hey, Sheriff.
It's always good to be on the show, John. How's things going today?
Things are going well. You know, I was down in New Orleans at a National Institute of Jail Operations conference, and your name came up several times. You were an award winner. No, it was good. Okay. You were an award winner. So tell us about that award.
Well, the National Institute of Jail Operations has some legally based criteria. So it's not about what somebody thinks. We're following the law, and they have it built on not only federal court cases, but on Alabama court cases for our training. And it's pretty extensive. It's not just that easy to get, but over the last year, myself, the chief deputy, my jail administrator, my lieutenants in the jail, and all the sergeants have worked hard and become nationally certified corrections officers through the National Institute of Jail Operations, and we're just striving to make our jail better, and employees we have there, make them better trained so we can take care of the people, make sure the citizens are taken care of by one, keeping the inmates in, making sure we take care of the inmates properly under the law, so that way it protects tax dollars as well. So, and it's the right thing to do.
It is fully trained, well-educated, disciplined correction staff, makes your jail the right place to have people.
And I'm really proud of them, and it's making a difference. So we're doing that, and you know, it's been a tough year for everybody with COVID, and the jails are no different. So.
Nope, and guess what? You added some more people to your jail. Let's take a look at the count.
The count brings the count up to 4,829 people put in jail, all because somebody helped us out with that, and we're very thankful. So.
We are thankful. That's a good count. 4,800 some odd people is remarkable.
It is. I think we had 5 arrests this week. So
that's super.
Never gone a week in the 15 or 20 years we've been doing this. We've never gone 1 week without arresting somebody. That's pretty amazing.
That's a good thing to say about your staff and the citizens of Calhoun County.
Absolutely.
Well, we're going to take a break here and come back with our first half of the lineup here on Calhoun County's Most Wanted.
The Calhoun County's Most Wanted. For the start of the lineup, we have Ricky Gilbert, Birmingham, Alabama, failure to appear, possesses controlled substance, use, possess of drug paraphernalia, theft of the property in the fourth. Janine Smith of Odenville, Alabama, probation violation, possesses controlled substance. Brandon Yarabro, Woodland, Alabama, failure to appear, possesses controlled substance. Cordovis Johnson, Birmingham, Alabama, failure to appear, possesses controlled substance. Erica Hazel of Talladega, Alabama, probation violation, possesses controlled substance. Brianna Cottney of Sylacauga, Alabama, probation violation, receiving stolen property, and third. If you have any information about these cases, please call the Sheriff's Office at 256-236-6600.
Over the past few weeks, I've received numerous calls from our citizens who have been contacted by scammers who represent themselves as employees of the Calhoun County Sheriff's Office. These scammers try to identify as our deputies. They may say you have a warrant and we will be out soon to arrest you. They are trying to scare you. Only on very, very rare occasions will this office contact you about a warrant. The Worthless Check Unit will mail a letter or a card in an attempt to resolve the situation of a bad check. The scammer may say to avoid arrest, you can pay your bond up front and never have to appear in court. That's not how it works. The scammer will say a lot of things to try to scare you into paying them. You cannot pay a bond over the phone, by Amazon, iTunes, eBay, or any other type gift card, or even cash transfers. This is not how you can avoid jail time. If you receive a call like this and are in doubt about the authenticity, hang up, then call us at the Sheriff's Office to verify the warrant, 256-236-6600. I'm Nancy Hilton with the Calhoun County Sheriff's Office, and I don't want you to get scammed.
Welcome back. We hope you saw somebody in the lineup that you might know where they are. If you do, give the Sheriff's Office a call. You call, they haul. We're here with Tiffany DeBoer, Public Information Officer for the Calhoun County EMA. Welcome, Tiffany. How are you?
Yes, glad to be here. I'm great.
How's things at the EMA?
You know, for I guess the past year or so, it's been pretty constant. I'll
It's
say
kind
that.
of like an emergency, eh?
Yeah.
Yeah.
We've got a constant emergency for the past year.
That's
Year and a half.
Yep.
Yeah, including also a tornado that happened. So
Tornadoes.
lots going on at the EMA
We dodged the tropical storms and hurricanes so far.
so far. Yes.
So tell us, COVID is on everybody's mind.
Yes.
Okay, the Delta variant is running rampant. So kind of bring us up to speed with what's going on here in Calhoun County.
Yeah, so with the Delta variant, they say it is more contagious, and that's why it's spreading again, and we're having another wave. So the hospital put out a graphic yesterday. They have 50 people in the hospital. I think they went up to 52 at some point last week, was so far their peak during this wave. About 4 of them were vaccinated, which is only about 8% of the people that are actually in the hospital. And then, you know, we look at different models and kind of look at numbers and stuff to see maybe what's going to happen, if this wave is going to continue for a while. But hopefully, we're kind of peaking at this time, and hopefully we'll be coming back down with infection rates and things of that nature.
We think we're peaking then.
We're
hoping we
Yeah,
are.
of course, what we look at is called the IHME model. It's just a national model, and it's just a projection. It's not fact. It's a tool to help you plan, basically.
Well, you know, just this week, Anniston fireman, 40 years old, lost his life to COVID. And, you know, back in January, I was kind of on the fence about getting a vaccine, but I decided to get the vaccine in January, and I followed up in February. And I know that this is a great topic. It can be divisive. You know, if somebody chooses not to get one, I'm not calling them any names or anything like
Right.
that, but I can tell you over the last year and a half, I probably know 4 or 5 people personally that's died from COVID. And I can't name 4 or 5 people that I know that's died from cancer or from a heart disease, or if you even combine those two. And, you know, I looked at those numbers from RMC as well, and, you know, it seems that the vaccine, while it's not perfect, seems to be helping those who have it at least not be hospitalized, or if they are hospitalized, they're not on a vent. So, you know, I really encourage people to consider getting the vaccine. Just yesterday, the FDA approved the Pfizer vaccine. If some people were waiting on that, and the Pfizer and the Moderna are very similar. And you can cross match. You could get one Pfizer and one Moderna, I've been told. So, and I'm not an expert, but I know that what if our grandparents wouldn't have taken the polio vaccine or the measles vaccine or hepatitis, different things that we've eradicated through vaccines. And I know everybody has a concern of what they're putting in their body, but if somebody had cancer and they come out and said, this is not an FDA approved thing, but it can give you some hope, it might cure it, they would probably take it. So why won't we take the vaccine here? Just some points I'm trying to make that I really wish people would consider getting vaccinated, that I really think that that's going to make a difference in whether or not some people live or die. And when it gets to the point, once you cross a certain point, I think it's very difficult to survive the COVID if you get in a bad way. So I just really, please think about getting vaccinated. Go do it. Do it for people you love. Do it for your lives.
Yeah.
So the Delta variant is spreading this time more in the youth, and I think the Pfizer vaccine is good for 16-year-olds and up. Is that what I've read?
I believe so.
Yeah.
I know a couple of the vaccines are 12 and up,
Okay.
and then I think Pfizer, yes, is a higher age range. But so yes, the age ranges of the hospitalizations currently as of yesterday are from 19 all the way up to 92. So there's a 19-year-old in the hospital right now, which is, you know, the previous strains didn't seem like it affected the young people as much. Well, this strain does, and so yeah, I mean, if you can get it, of course, you know, we get our recommendations from the CDC, the health department, the local doctors. We tell everybody
From
if you
scientists.
yes, if you have a question, because it's a new virus, it's a new vaccine. If you have a question, it makes sense that you have questions. Ask your primary care physician, call the health department, just ask an expert.
Get it from an expert. Don't take everything you see on this TV show or social media to be the gospel.
Right.
You know, there's many things out there. A lot of people are doing things for political reasons. This, you know, life and death shouldn't have a political reason.
Well, certainly people are getting ill, people are dying. It is, in fact, an emergency. And we're going to take a break, and when we get back, we're going to talk more about where the vaccines are, but stay with us and stay tuned for the second half of the lineup here on Calhoun County's Most Wanted.
Welcome back to Calhoun County's Most Wanted. For the second half of the lineup, we have Russell Alvin of Lincoln, Alabama. Failure to appear. Possesses marijuana in the second. Use, possess of drug paraphernalia. Eva Bailey of Piedmont, Alabama. Failure to appear. Possesses controlled substance. Use, possess of drug paraphernalia. Christopher Perry of Talladega, Alabama. Failure to appear. Breaking and entering of a vehicle. Jarvis Leonard of Addison, Alabama. Probation violation. Assault in the first. Jimmy Nonoli of Addison, Alabama. Probation violation. Escape in the third. Possesses controlled substance. Christopher Moore of Jacksonville, Alabama. Probation violation. Violation of the Sex Offender Registration / Notification Act. Marco Treje Resendez of Oxford, Alabama. Failure to appear. Sexual abuse in the first. If you have any information about these cases, please call 256-236-6600.
And welcome back. That was the second half of the lineup. Hope you saw somebody in there you know. I'm sorry if you did, but if you know where they are, you need to give the sheriff's office a call. Sheriff Wade has deputies standing by to take your call and bring people down to the hotel, Calhoun County. We're here with Tiffany DeBoer of the Calhoun County EMA and talking about the COVID crisis we have going on. And when we were going off into the break, we were starting to talk about vaccines and vaccine availability. So tell us what's here in Calhoun County and how we can find out where to go.
Yeah, so of course we started out doing the max vaccine clinics because there just wasn't anywhere to get them. Well, now, good news is you can basically get it anywhere. If you go to vaccine.gov, you can type in your zip code. You can even choose what vaccine you want, and it'll show you who has it, if it's in stock, and where you can get it. And I think there's probably 30 to 40 places just within Calhoun County that you can get it at.
And we have been vaccinating inmates. We have had the health department come down 2 or 3 times to the county jail to do that, and we're doing our best to disinfect and do things and make sure they have masks. But the vaccine is, I think, has helped us, and we're in the process of having them come down. Once again, we're going to try our best to have the health department come down monthly to offer vaccines to people. So, you know, wish we could offer them when they come in. We just don't have the ability to store them. But we're doing our part with the vaccine on that as well.
Nice.
Of course, vaccine is voluntary, but choose wisely. The more people that are vaccinated, the less this variant will spread, and the less of a newer variant we might have, right?
Correct. Yeah.
Make sure I'm right on this. I've heard that vaccinations in Alabama have been skyrocketing. Is that true?
Yeah, from what we've seen, interest has definitely been at a high point. And even me personally, I know a lot of people who've came up to me and said, hey, I just wanted to let you know I got it. You know, just because I talk about it with people. If they have a question, you know, I try to point them to Dr. Magadia or point them to good sources and stuff. So we're definitely seeing a lot of people, at least with more interest, but then actually going and getting the vaccine now.
I know a couple of people that we work with that have said they're going to get it, and so I'm encouraged by that. And You know, especially yesterday, I think we, the news media, us, their sources need to keep pointing out the FDA has now approved a full approval to the Pfizer vaccine. So I think those people that were waiting for that, now that excuse has been eliminated. So go get it.
Well, and it'll be good to get the kids. I know even in Calhoun County, we've had some schools that have had to go on quarantine. I think Randolph Park shut down for a little while because they had a couple of students that tested positive. Our Success Academy had a student test positive. We had to send them home for a week. So that it's percolating in our elementary schools and junior high and high schools, and that's sad because it didn't do that last year.
Right.
Right. So it's obviously getting into the kids. I know Children's Hospital in Birmingham has got a large number of children. In
Just
ICU.
yesterday, I drove by I call them a doc in the box. You know, these doctor offices that are, you know, urgent care type places. And when I say the parking lot was full, it was overflowing. You know, it was jam packed. And we even remarked, "Wow, you know, there wasn't a place to be had in the parking lot or on the grass around it." So I think definitely we're seeing a high surge of it, and I don't want to see anybody lose their life when they could get vaccinated and go from losing their life to maybe just being ill. So, you know, I really encourage people to do that. Please think about it. Please, if you're on the fence, do some research. Don't believe me. Go out and get some trusted sources to do that.
So the EMA is one of those trusted sources, and you know, last year when this first slammed into the United States, I know the EMA was front and center, coordinating response efforts with vaccines and all kinds of stuff. And so the dust has settled, things have become more routine. What's the EMA's role now?
Yeah, so we started out, of course, with testing, trying to get that out, and then it moved to vaccines. So now that vaccines are readily available, we're still coordinating with all the different agencies, making sure that everybody's still staying connected and getting the help that they need. But we've also started working with the hospital on the monoclonal antibody infusion type things, kind of just discussing that, what that looks like, and how maybe we can expand on that. It's an infusion that you can get when you get COVID to try to keep you out of the hospital, basically.
My brother, who's up in Connecticut, he and his wife, they're in their 70s, contracted COVID. They've already been vaccinated, but they gave them the infusion. So do you know any more about that? What exactly does that?
I'm not very sure on the medical side of things. I just know that if you get it soon enough, it really helps you stay out of the hospital, basically.
Okay, it's kind of I think it's probably got antibodies and stuff like that in it. All right, so EMA doing a great job coordinating resources and information. You got a clearinghouse. What's your website?
CalhounEMA.org.
Is that easy to remember?
Easy to remember.
Is there a phone number that they can call?
Yes, it is 256-435-0540.
So don't mind, give them the site to locate a vaccine,
Yes, vaccine.gov.
vaccine.gov, and you can find out where you can get a vaccine in Calhoun County. And you said there's 40?
I think about 30 or 40 just within Calhoun County.
So no excuse if you want a vaccine. There's plenty out there, plenty of places to get them. So please, if you're going to get one, do get one sooner rather than later. And we want to thank you, Tiffany, for being on the show. We appreciate all the great information. Stay with us because we're going to be back with our Crime Stoppers portion and the infamous crazy criminal here on Calhoun County's Most Wanted.
Crime Stoppers. Between the hours of 12:30 a.m. and 2 a.m. on August 20th, 2021, numerous vehicles were broken into at a location on Torian Lane in Anniston. Cell phones and currency were stolen. On August 16, 2021, an individual located a 2009 Honda Goldwing for sale on Facebook Marketplace. This individual began online correspondence with the seller, who claimed they were about to ship out for overseas duty and didn't want to keep it in storage. After sitting payment of $3,000 for the Goldwing by reloadable money cards, the buyer waited for the shipment. The Goldwing never arrived. The seller ceased contact with the buyer and erased all messages. Between November 5th, 2020 and July 24th, 2021, a 9mm Glock was stolen from a vehicle on Old Sulphur Springs Road in Wellington. If you have any information about these cases, please call 256-236-6600.
Stupid! You're so stupid!
Well, Sheriff, it's time for your crazy criminal.
This time it's over the pond over there in Britain. And this fella here, I don't have his name, but he went into a bank and presented this note. And I'm trying to read it myself. I'm not sure. Your scream, wait, stop with GV, not just hand over the 10s and 20s. Think about the customers. Well, the clerk couldn't read it or understand what he was doing, so after she was asking for help with what it said, he turns around and runs out.
Oh, well, there you go.
She described him as a cheeky fellow.
A cheeky fellow.
And then he actually produced this note at another bank down the street and got $3,300, and he was arrested for both. So if you're going to use a note to rob a bank, you might want to make sure that you're able to clearly communicate.
Penmanship is everything. It's
Penmanship is
important.
everything. You don't want to be that cheeky fellow.
But you know, he was persistent.
He was determined
To
to go to jail, and that's
he
what
was.
he did.
He went to jail with some money for store call.
Yeah.
And it was all good. Yeah. Well, Sheriff, thank you. Congratulations on your reward.
Thank you very much.
For being a proactive, health-conscious sheriff and giving vaccines to
I think we've vaccinated over 250 inmates since we've done this, and we can't make them. We can just offer it, and as it goes along, more and more are wanting it, and we're going to do our best to make sure that it's offered to them as well, and try to keep COVID out of our jail and keep people alive and safe.
Community-conscious law enforcement right here at the Calhoun County Sheriff's Office. Well, we thank you. We had a wonderful show. We thank you guys for tuning in to Calhoun County's Most Wanted. Please tune in again next week, and we hope to see you there, but not in the lineup here on Calhoun County's Most Wanted.